And quite frankly, the healthcare infrastructure, much like the education infrastructure, are really the only two social infrastructures, and costs of everything have actually just been dumped in that lap of healthcare and education. Whether it's the unruly kid, right? The child with, ADD or whatever, school problem gets dumped in healthcare, family problem gets dumped in school care, but that's because we are an infrastructure. It's not because it should be defined as an insurance cost or a healthcare cost, depending upon how you want to define it. But I think it puts us in a really tough place in a debate when they start to offer costs of healthcare and they expand that definition. You can make it to be anything, as in food. I mean, with the right patient, healthcare does pay for food. For the person who has a PEG, right, it does pay for food, but it doesn't pay for my food. So I think we have to really get these definitions economically sound and a marketplace that's economically sound. And one of the things that is so important, the copay controls demand. If the patient has a piece of the last dollar covered, you control cost. Hello, government. You want to control the cost of Medicare? Private contracting, the patient pays the difference. Very simple. You post your prices in your fee schedule. Medicare can post what they pay out. The patient pays up to the difference. You have the opportunity to give back as charity should you decide to do so. Now, of course, it's a felony if you don't charge everybody that 20%. Take that away and let us get back to the business of doing charity care when we feel like it. Charging and competing. Don't you want to be better than the guy down the street? I mean, really. Think about when we went to medical school. We were competitive souls. We didn't get there because we were sitting on our rear ends. We got there because everybody in this room was the top of the class, competitive, wanted to be better. Admit it, am I right? The current system, fixed pricing, does nothing for quality, does nothing for competition. It's lazy. It is lazy. We got lazy. Well, I'm suggesting that we have to stop being lazy. We have to retake the profession, be professionals, offer value-added service, and charge for it. Yes, I belong to the AMA, as I said, and the first time I was there and I talked about, and then we called it balanced billing, but that had a bad connotation. I got a standing ovation. And then the Board of Trustees called me into the back room. Said if I ever did it again, I wasn't invited back. Amazing. Now, there are all kinds of things about the AMA. The fact of the matter is that they exist, but there are other factions even within the AMA. We now have a huge consortium of physicians and state organizations that are working to really do the kind of thing that we believe in. So there are organizations out there, and I can talk to you about those ad nauseum whenever you want. I'll get you on listservs. I'll get you in the loop, however you want to be in the loop, and your patients in the loop. As you're sitting here, you're thinking, all right, I do this, and my patients are going to say, no, thank you. We have that paranoia about us. We all do. I did. What I did is I had these evenings with Marcy. And I had wine and cheese. That was a good way to start. Good wine, good cheese. And I invited everybody, and I told them what I was going to do and why I was going to do it, and I offered that they could sign up. People who didn't have a pot to piss in signed up. They said, I value you. I don't need a car this year. Okay? It was a decision. Some of my richest patients didn't sign up. It's a value decision. I'm not here to cast aspersions or in any way to make any comment about their decision making. But it's an opportunity. And there will be patients in every demographic, Beverly Hills to really immigrants, truly immigrants. I have immigrants. They are so ever grateful. And let me tell you, they don't bother you. They respect you because you respect them. It works. It's a good system. Don't be surprised by the patients who absolutely want your relationship. And similarly, don't be surprised by people, just because they have money doesn't necessarily mean that they value this opportunity. Their decision. Many of them have come back, by the way, because when they went out and found the real world, it wasn't so pleasant. You have to decide, and this has been said already, who are you, what are your goals, your strengths, your weaknesses. My patients mostly come from other patients, but I get lots of physician referrals. And the reason for that, interestingly, for those of you who are specialists, my specialist friends love me because my patients come prepared. They come with all their stuff. I've actually called ahead and said, hey, John, I'd like you to see Mary, and this is my question. What a concept. And then John can answer the patient's question and take care of and integrate that care into everything else that's being done. So we allow the specialists to do their job. My surgeon friends don't do HMPs, even the post-op care, they don't need to see the patient. They get to be a surgeon. And I'm in the operating room with them, by the way. There is so much to be learned by being in that operating room and seeing the pathology. And truly, I think you can help people a lot better if you're there. And now I have the time to be there. I make the time to be there. It's really, it's good. It's better medicine. Again, we talked about where's your practice, what are the demographics, all these things you need to start to think about, and then develop your business model. There are as many business models as there are people in this room. In retrospect, again, as I said, there's no less work, it's better care, I have the time to get it done and do it right, and I get a good night's sleep and time to save the world. And with that, that's Unkasali. J. Solomon Katz. J. Solomon Katz, chairman of the stress management department, sees more patients than I do because patients love to come in and just talk with him. The problem is that Unkasali loves sushi, really, fish, mahi-mahi. We buy it at Costco in big bags, frozen. It has to be freshly thawed. And Costco ran out. Can you believe this? So I went to Sam's Club, and I've talked to the owners of the company, and it's coming in on Sunday, thank God. But, that's Unkasali. Family, right? He's part of the family, part of the mishpucha. It works. And with that, I want to tell you about how we change the world. While I show the economics of private contracting to our legislators, most of them said, that's just fascinating, but how do we make it work politically? It was politics. Then I went to the person that I considered a very moderate senator in my own home state, Feinstein, and we wanted to work with her, and she basically said, you know what? Get over it. I'm voting for the bill. This is politics. I don't want to talk to you. She didn't. I was pissed. But I said, being a good listener is part of this process. I'm hearing you. It's politics. I'm going to beat you at your own flippin' game.
Yes.
So I probably networked with 20,000 physicians across the country, thanks to Catherine and all the organizations that we're involved with. I YouTubed a YouTube for Scott Brown. I emailed, faxed, Twittered, Facebooked, everybody. And by the way, my patients Facebook, Twittered. All my patients are involved. Senators get more letters from my office than any state. Seriously. My patients, their friends, it happens. I had Democrats, people who had never voted for a Republican, giving $2,000 maximum to Scott Brown. I convinced them that this was the only way to stop the bill. Then I engaged my fellow lobbyists, people with real bucks and real power. And I asked them to help. The first time I asked them, they told me I was nuts, 35 points behind. Hello, Marcy, what are you doing? But I asked them to please keep their ear to the ground and let's watch this thing play out. And we played it, and we played it. And about 4 days prior to the election, CAP, that's the Cooperative of American Physicians. Do you have CAP here in Texas? CAP is in California. It's very, very politically, it's my malpractice insurance. And they're very politically involved, and they had their ears to the ground, and they had done their polls, And it was very interesting when you hear how they do their polling. I'll tell you all those stories later. But the bottom line was they put in their money, they put in their time, they put in their people on the ground, and you know what happened on Tuesday. They had a party. They congratulated me for changing the world, but I think we all did. Can come from one person, one computer. But what I really do, outside of stopping that horrendous health care bill and giving our patients in this country a chance again, is every day I change the world. But it's one patient at a time. And I swear to God that's what you do every day. I swear to God that's what you want to do every day. And this is your opportunity to take back your profession and give your patients the opportunity to empower themselves, to own their life, and have that better, productive day. That's why I get up in the morning, that's why I'm a happy doc, and that's what I extend to you, an opportunity to become a happy doc.